All right. Well, welcome everyone. I'm Emily Williams. I'm the director in the Office of Alumni Family Engagement. Thank you for joining us for day one of Falcon Weekend. You're here today in our Mind, Body, and Soul Health and Wellness for our Bentley student panel. I am joined by two of my colleagues who will introduce themselves in just a moment. I do want to let you know, unfortunately, Julia Matthews, who is our current director of the health center, it was unable to join us today. She has a lot going on and was unable to join us due to a scheduling conflict. So my colleagues to the right of me will be filling in for her and sharing her area of expertise. But without further ado, I turn it over to, let's start with you, Jessica, if you want to introduce yourself and your area to our audience, both here in person and on Zoom.
Sure. So good afternoon, everybody. It's good to see those of you here and welcome to those of you who are tuning in. My name is Jessica Greher Traue. I'm the Director of Wellness and Prevention Services here at Bentley.
And my name is Peter Forkner, and I am the Director of the Counseling Center here at Bentley.
So although Julia is not here today, we are prepared to speak and give a high-level overview of their area. So we have a few slides prepared for each of our areas for you this afternoon, and then Emily has some prepared questions for us so we can share some further details with you. Next slide. So if you can advance. Perfect. So one thing that it's really important for you all to know is although we're three distinguished departments on campus, we really work collaboratively to make sure that we are providing the most holistic care for your students. So we do represent different interdisciplinary lenses, but we oftentimes are coordinating care and connecting and communicating with each other, especially when we do have students who we share, or have shared concerns with us. We consult, so we're making sure that we're getting them the utmost resources and support. Next slide. So we'll start off talking a little bit about our health center. So if you're not familiar with our health center, it's located in Rhodes Hall, which is just across the way from the building that we're in right now, which is our student center. So if you exit from the second floor entrance of this building, it's just across the walkway from us. Their entrance has a greenhouse outside of the door, so it's something that's pretty distinguishable for those of you who've never visited their space before. Next slide. And in typical academic years, our health center functions very similarly to the way your primary care physician's office would work. And so they do provide a lot of routine care and screenings. Students would contact their department to schedule appointments. During COVID right now, they are doing telehealth visits and triage, and students should be checking the Bentley Health website for updated service hours. So for example, if their staff are clinically busy with managing students who need testing for symptoms, they might change their availability that week so that they are only doing telephone triage, and then they'll notify and update students when they are seeing students for patient care. If they are unable to see students for in-person appointments or telehealth appointments, they would coordinate with that student for referral or transportation to one of the local urgent care centers that are pretty much about a 5-minute drive away from campus. We have several providers that are really close by. Next slide. So all of our offices are confidential. So that means that any students who are seeking care in the health center, counseling center, or my department, can rest assured that the information that they share with us is going to be kept private. So students, if they are meeting with our medical providers and it's something that the providers feel it's something that our parents and families need to know, they would ask the students permission in order to speak with you. But if that permission is not granted, then the providers are not going to be sharing any of their medical information with you. Next slide. It's important to also understand too that almost all of the care that's provided by the clinical staff over there is included with the cost of your tuition. So students should be bringing their insurance cards with them for visits, because some things like lab tests and prescriptions will be billed to the student health insurance, but office visits are not anything that we ever charge to insurance. Those are included in the cost of tuition. Next slide. And then finally, their hours, they are open Monday through Friday, 8:30 a.m. to 4:30 p.m. After hours, students can contact University Police. And again, their department at University Police are really helpful at coordinating transportation if students do not have transportation, and also serving as our first responders after hours to more emergent situations. this is now you, Peter.
Great. So yes, this is the Counseling Center. I think the most important thing I can share with you today is that to remember our phone number. Right now during COVID times, we're seeing people remotely, and I can go into a little bit more about that. But if you ever need to make an appointment, if you have a question, if you just like to chat with our front desk person, Linda, who is amazing and just wonderful to talk to, just call the phone number and you will be connected, and we'll be able to answer any sort of question. And we are located above Bentley Police when we are seeing students in person, and we hope to, as things shift this year, to be able to do that later on. So in the Counseling Center, we have 5 licensed psychologists, and we have 3 practicum students who are obtaining their doctoral degrees in psychology. And we also have a front desk person, Linda. She's great, as I mentioned. This year, because we're anticipating the extra needs of mental health, we've partnered with a telehealth company, Health, and they are also supporting our students. So that's another great thing. We also have, as a part of Mantra, a psychiatric nurse practitioner for students who have never been on medication and need to be evaluated. So I always mention that because many students are already coming into school already on psychiatric medication and are seeking ongoing support. However, this person is only for those students who had never been evaluated and need that. So it's a nice resource for students who find themselves in a position of needing to be evaluated, but not having the resources to do so. So what is it that the Counseling Center does? Well, as I mentioned, we have 5 psychologists. We are mental health providers. So I always like to say that we see any student who's dealing with any significant mental health issue. So should a student be worried about something, or they are struggling with a breakup, or they're going through anxiety, or they have depression, I want them to come to the Counseling Center and meet with one of our providers. And that first appointment is known as a consultation appointment. So for students coming in, sometimes they have this expectation they're going to walk into a room, there's going to be a guy with a lab coat who's going to sort of sit them down and make them, tell them their most deepest, darkest secrets. That's not the case. The first appointment is just a 15-20 minute appointment where you're going to meet with somebody, talk about what's going on, and based on that appointment, you're going to get a recommendation for what to do going forward. Now, it could be just meeting with somebody for 20 to 40 minutes is enough to sort of help that person figure out what's been going on and have a path forward. But it could be that continuing to meet with somebody in some capacity, whether that be on a regular basis or just as a follow-up, would be helpful. And in that case, we do have these providers to be able to continue to meet with those students in a short-term capacity. Now, if a student is coming in with a significant mental health issue that they have, or they have that requires either more, like it's a more of an intense issue, or it needs more ongoing care or specialized care, then we would help that student get connected with the proper resources in the community. But we want to be that first touch point for any student who is struggling with mental health, and we're able to make those recommendations. Yeah, that's good. So I already mentioned this a little bit, but often people are asking, what are the typical things that people come into the Counseling Center? What are they dealing with? And I would say around now, it's generally students struggling with getting used to being on campus, adjusting to campus culture, finding friend groups, those things like that, which can create a lot of sense of discomfort, feeling isolated, those kinds of things, all magnified by COVID, obviously. So that's typically what we're seeing, but we see students who have anxiety, who have depression, who have experienced grief, who are, struggling with substance use, really, you name it. So again, I just sort of want to reinforce that we should be like a first stop for somebody who's like, hey, something's really not going well. I'm not sure what to do about it. So make an appointment and we'll help you figure it out. So with respect to COVID, as I sort of referred to earlier, we've had to make some adjustments. The state of Massachusetts designates the Counseling Center as a health center. So thus we have to abide by certain principles of having regulations with regards to mask wearing and with regards to hand washing and symptom checking and all these kinds of things that can be more difficult. And so the one good thing about last year when we were completely remote, we realized, and the students realized, that actually doing remote therapy was actually a good thing. If you had asked me, months, a year and a half ago, you're going to take your entire staff remote and it's going to be okay, I would have said you were crazy. And in fact, I do these evaluations every semester. And what we found out is that the students actually found it great. And the truth is that providing remote services without masks is way better than providing services in person with masks. The analogy that I've been making lately is like, because a lot of people are like, hey, I want to come to the counseling center, I want to meet with somebody in person. But we depend so much on the mouth as a way of reading emotion. It's important for building trust, for building rapport, not only for the provider to see this, how the person is reacting, but also as that person in the room with a stranger, you want to make sure that the person on the other side is understanding what you're saying. And so the analogy that I make is like, providing services in person with a mask on is like asking a surgeon to provide surgery with one arm tied behind their back. It's not as good. So anyways, we've got a great staff who are really adapted well to the remote provision of services, and things are going great. So we've also increased in this last year and a half, and in conjunction with Jessica's team, we've done a lot of providing content online. So we've developed a YouTube channel that has a ton of different resources, whether you're a student or not, really, who can meditation videos explaining things like anxiety and depression. We have an online anxiety and stress reduction workshop that you can just take at your leisure. We have the Good Vibe series, which you're going to talk about that. Mm-hmm. You'll hear a little bit more about the Good Vibe series, which I've been really excited about. Which are based on the principles of positive psychology, things that students can do without accessing our resources directly. Yes, so again, as Jessica pointed out, all the services are part of the cost of attendance. So students don't have to worry about pulling out any cash or an insurance card or anything like that. So that's a real benefit. Not to mention, we are completely confidential, and this comes up a lot. In that, first of all, I want students to know that we hold this extremely seriously, and in fact, our licenses depend on it. So anything that is shared with us, if you're 18 or older, is considered confidential, and we're not allowed to disclose that to anyone, even a well-meaning parent, if without explicit written permission. There are some exceptions to that, obviously, if there was, a health, a safety risk or certain other circumstances, but I often run into the problem of a parent calling my office and saying, oh, I know my son Johnny saw you today and I want to talk about it. And Johnny clearly told you about the appointment, so Johnny doesn't care that you know. But if I don't have anything on file that says it's okay to talk to you, you're going to get a response from me that says, I'm sorry, I can't confirm or deny if that person's been seen here today. But I would encourage you to get Johnny to sign a release form if he indeed was here. So I think that's a good thing. As frustrating as it can be, it makes students feel safe that what they share with us is just going to be between themselves and the clinician. We're open 8:30 to 4:30. This is for any sort of initial appointment. However, our partnership with Mantra Health has allowed us to expand our hours so for those students who are too busy during the day, we now have, if they have ongoing appointments, they're able to meet with somebody possibly after hours or on the weekends or something like that, which has been a great benefit of that partnership. And yeah, that's pretty much it. Protocol. Okay, so also, if there if there's ever sort of a crisis or an emergency and somebody needs to speak to somebody right away, we know that those sort of things don't always happen within regular business hours. So you can still call that main number. Again, that's the important thing to remember. And after hours, there will be a prompt. I think it's you press 3 and you're connected with our after hours clinicians. So And that can be a student who's in crisis, or if a parent has a question or is worried about somebody, that's the best way to do that. So there's always support available.
And then finally, my area, we share a suite with Peter's team. So we are also located above University Police. Next slide. So wellness and health promotion sort of acts more like the ambassadors to our clinical teams. And so we are often the most outward facing of the three staffs and out and about on campus, doing programs, doing trainings. And we really tend to take more of a public health framework to the work that we're doing. And we use evidence within our existing population and within college students nationally to help inform what are the key areas that we're going to be looking at. And we really want to focus on those areas that interfere with students' academic success, sense of belonging, or personal safety. And so most of the programming that comes out of our area does take a focus on stress, worry, and self-care. So kind of mitigation for some of those feelings or experiences of stress. Sleep, which interferes with a lot of our students feeling well. Oftentimes we'll find that when students are in distress and we talk to them about how their sleep patterns are, they aren't necessarily engaging in consistent sleep patterns, or they haven't slept well in a couple of days. And so really trying to recalibrate our students' focus on sleep and consistency and good quality sleep can go a long way with a lot of concerns that our students experience. We also do a lot of work with substance use prevention and response. So our team takes the lead on harm reduction education around alcohol, marijuana, nicotine use, and other substances if indicated. And should your student ever find themselves involved in student conduct for alcohol, marijuana, or nicotine use, oftentimes they're referred to our office to do some restorative and harm reduction coaching and education so that we can work together to find strategies to prevent anything negative from happening in the future. And then finally, we do a lot of work on healthy relationships, consent, boundaries, and interpersonal violence prevention. So we look at dating violence prevention, stalking prevention, and then sexual assault prevention as well. Next slide. We do, as I just alluded to, provide some individual clinically focused services. And so I would say it does come more from that coaching framework in terms of if a student is experiencing any kind of concerns or negative outcomes from their choices around alcohol or other substances, our team is often the first line that will meet with the student, sit with them and say, like, let's figure this out together. Let's identify what's happening, what's going wrong, so that we can provide you with the tools or resources to make sure that that's not interfering with your success here on campus. And then for students who might be looking to cut back on vaping or other nicotine use, we do have a small percentage of students who still engage in those behaviors. We do offer cessation coaching and support services for them as well. Next slide. Here's a high-level overview of some of the programs that students can expect to see out of our area. The first is bystander education. So we run leadership trainings that empower students and build confidence and skills to intervene in risky and problematic situations. So if they see their friend is making choices that might be impacting their well-being, or if they see something happening in a social setting that has the potential to be harmful for another individual, stepping up and cutting that off before that takes place is really important. And so we have a nationally certified curriculum that we implement with our students for that. Peter mentioned earlier something called the Good Vibes series, and those are evidence-informed strategies that are rooted in positive psychology. And I know that's very jargony, but essentially science says if you do these things, they are going to boost your mood and well-being. And these are not things that cost any money. I think when we think of the word wellness, oftentimes it's diluted with products that we should be buying to improve our well-being. Nothing that we are talking about here has to do with a commodity. It is more of a skill set that you can build into your routine that takes less than 5 minutes time in a weekly basis that really goes a long way for boosting your mood. And so we've developed an entire series that can be either self-guided or students can utilize these worksheets and implement them with each other in peer-to-peer setting. So an example of a skill set that we might focus on that's either self-guided or part of this program would be, say, the concept of savoring. And savoring is remembering a past or looking forward to a future event in full detail, utilizing all of our senses. So we would give students a couple of activities where they can practice that skill set and then be able to report back on that experience. We implemented these last year. We had tremendous success, and a lot of our evaluation from students who participated in the Good Vibes series was extremely high. So we're going to be continuing on with that. We also do some work with mindfulness and meditation. Peter mentioned that there's some things online. We have a 4-week mindfulness and meditation course that we implement. And then our spiritual life team also offers weekly mindfulness drop-in classes for students. So if students are feeling really stressed out one week, Wednesday afternoons at 2 o'clock, there's always going to be a brief drop-in mindfulness class. We also have a program that we're launching in the next couple of weeks. We've run it previous semesters called Project Connect. It's a small group dialogue program where students come together, usually in groups of 4 to 5, and they're partnered up with a trained student facilitator. And it's really focused on getting to know each other at a deeper level. And they meet for an hour for about 4 to 5 weeks in a row. And then on the 5th week, the team comes together and decides what's one small campus improvement project you want to make. How do you want to improve the well-being of others that are here at Bentley with us? And they come together and they do this small improvement project. But what ends up happening is it builds protective factors for feelings like loneliness or homesickness, because they're getting to know other individuals that they wouldn't necessarily have gotten to know had they not engaged in this program. Next slide. And then finally, we have 2 peer education programs on campus. Our peer educators are trained student employees in our office. We have one group that focuses more on emotional well-being and self-care. And then we have another group that focuses more on our prevention work. So if your student is interested in any of these areas, please have them contact us. Like I mentioned, they are paid positions and we do have some openings, but also these are groups that are often out and about doing a lot of events and workshops for their peers during the academic year. So maybe this is a good time to pause if you had some questions that you wanted us to chat about.
Thank you, Jessica. Thank you, Peter. So we know that COVID has obviously changed a lot, and you've referenced some of those changes in your presentations, but can you speak to anything else that it would be important for our audience to know about changes since the pandemic began?
Yeah, I can start.
Sure.
So from a mental health perspective, I think it's not front page news or really new to anybody here that COVID has had a major impact on people's mental health, not to mention students. Many of our students, I was reflecting just the other day that we have juniors coming onto campus who have only had 1 semester here at Bentley. And there are major developmental periods and milestones and experiences that sadly were sacrificed, and students were not able to navigate those spaces. So as a result, we're seeing a lot of students who are experiencing more anxiety, are experiencing more isolation, they're experiencing worry, and all of this is connected to these different experiences that they may have missed out on, or the circumstances of today. I mean, we can also talk about beyond COVID. There are lots of things going on in the world today that make people anxious. So all of that is to say is that many students are struggling, which is part of the reason that we really pushed the Good Vibes series. We pushed these self-accessing mental health resources, because a lot of students are coming in and saying, well, I'm struggling, but so is everybody around me. So what do I do about it? Now, yes, everybody could come to the counseling center and they could meet with a staff member and we'd be overwhelmed, but I don't think actually that's the best method of addressing what is sort of impacting people on a wider scale. I think it's more important that they are paying attention to the things that are going to improve overall well-being and increase not only mood, but increase resilience. And actually, I did give a talk to the first year students during orientation about the importance of paying attention to these factors, like doing things like savoring, engaging in meditation, engaging in stress release, relieving activities, exercise, appetite, eating healthy, sleep, all these things that we all know. Again, not surprising information, but the extent to which students who are stressed are focusing on these things we do have control over, we don't then worry about the things that we don't have control over. So I guess that's a sort of long-winded way to say that I think a lot of students are struggling, and they're certainly we're here as a resource to help them. But I think there's also a lot that we've provided online that students could have access to that will help them.
I would say besides service and changing just the modality at which we're, interacting with students, I would say I have heard from some of our student leaders this challenge of feeling more disconnected from each other and therefore feeling slight loss of sense of purpose. And so I'm not projecting that to everyone. It's just anecdotally what's been shared with me. In addition to what Peter mentioned, is trying, I think some of our students are now trying to find themselves again,
Mhm.
and also trying to find meaning in the work that they're doing. So.
Yeah, it's a comment on that just a second, because I think what you're touching on is also something that's coming up in the research, which is that it's not surprising to find that there's a decrease in motivation among students, and so I would just mention that just as something to pay attention to, and that you might find that there's more procrastination, there's more disconnection from the work. So you'll see students who are super excited about being here and about their classes, they might start disengaging, and that's just something to pay attention to and have them reach out.
And I would just say the last thing that has also been shared anecdotally is this switch from, once again, in terms of their modalities of learning. And many of our students had been remote, for this past year or even longer. And so now that readjustment to being in a physical space with 20 of their peers and their faculty member, and how to take notes and how to pay attention, and feeling somewhat fatigued from the energy it takes to, to be in these spaces. I think some of our students have recognized that they're more introverted than they thought they were. And so just that mental energy of being physically in class and that adjustment has come up as well.
That's a good segue for the next question around, so if parents or family members are looking to support their students, what are some of the ways that they can go about doing that?
Sure, I'll go. So I think, honestly, regular check-ins, and not, and I want to be cautious about the way that I say that, because with the advent of, and this isn't new, of texting, it seems like there's almost no way to not be checking in all the time, multiple times a day. So I think it's a good idea to check in on a regular basis. How are things going? But not, but also giving space. So it's weird to think that it's normal conversation between yourself and your child or your student to be texting back and forth, and that's a normal thing. But I think as you separate this natural process of de-individuation, maybe of being apart from your student, that might increase. And while that's a great thing, the student feels supported, it can create a sense of dependence, especially if the student is struggling to find their place here at Bentley. Again, I'm not saying this for everybody. I've seen that they can become over-reliant upon external support at home. And so I think it's good to be checking in on a regular basis. Hey, let's check in on every couple of nights or something like that, but making sure that they have their space to sort of navigate these struggles independently.
I would say also normalizing that as we all go through this readjustment, or for our new students who are just joining this community, their initial adjustment to college, there's naturally ups and downs that occur. So there's going to be moments when our students are going to be feeling really great about being back on campus. And then there's going to be moments where they're not. And normalizing that loneliness is a universal experience, whether they live 2 miles away from campus or 2,000 miles away from campus. And that what we see on social media, what they're seeing on TikTok, what they're seeing on Instagram is a well-curated version, and oftentimes sends messages of what campus life sends a difference between the perception versus reality of what a student experience is. And I would say too, if you haven't already done so, please, you cannot talk about this enough, but having conversations about expectations around healthy alcohol use, having conversations around expectations of setting boundaries in relationships, even consent. We know that students who have regular conversations with their parents about these important topics often associate with peers who do better at these adjustment and health decisions, and struggle less. And so even if you've had these talks, multiple times before, it's one way you can support us in the prevention work that we do, but also it's another way of you kind of providing a little bit of a safety net, in reinforcing those messages.
And I had a question in my head, now it's gone. The question is, thinking about the future and some of the trends that you're seeing, how do you go about evaluating your programs, assessing their success, and iterating on them, considering that how much has changed and we don't know how the rest of the year will go?
Our Vice President of Student Affairs has jokingly said that our division has become more reliant on assessment because of our teams. We rely on data to inform our programs, from the development of the programs, all the way through to the assessment and evaluation. So we're constantly doing pulse checks with students, or we're, asking questions to get feedback so we can adjust. I think what is challenging for some of the work that we do is when we look at national trends of students for self-reported experiences with physical health concerns or mental health concerns from, say, fall 2019, even through present, some of these concerns are not necessarily showing a change, but we also have to recognize that some of these health behaviors that we look at, it might take a year or two for the impact of this experience that we've all been through with pandemic to really kind of catch up. So we don't have crystal balls, but we know that, we're going to have to constantly monitor both our internal data and then what's happening nationally to help guide the work that we're doing.
Yeah, and I rely upon her for the data. She collects lots of great national data. I mean, I do a lot of assessment of the work that we do in the counseling center, as I referred to before, and so certainly make adjustments based on that. But a lot of the things we do, especially as it comes to sort of more public health efforts, it's really based on usually National College Health Assessment data, in which we can compare even our students to national samples, and it's really helpful in terms of identifying the particular areas that we need to focus on as a university.
Great. I will open it up to a couple of audience questions. If we have them, we will repeat them for the Zoom folks at home, but we have time for probably 2 audience questions. Do we have any questions? Yes.
About how long does it take to be seen if you wish to make an appointment?
At the counseling center?
Yes.
So the question was, how long does it take to be seen at the counseling center? We recently adjusted our method. So I can't promise it, but I would say usually you're able to see right away. It's better to make an appointment. Obviously we're pretty busy, especially as the semester has ramped up, but we try to make it so that students who need to be seen, right, or certainly if it's an emergency, you're seen right away, that we will make that happen. If it's better if you're going to say, hey, can I be seen, and we'll figure out a time. The thing that we start every appointment scheduling though is, because we're remote, we ask when the student is going to have access to private space, knowing their roommate schedule, things like that. And we have suggestions for on-campus areas to have private space if that's necessary. But so that's to answer your question. I would say anybody who wants to be seen within 24 hours is seen.
That's great. Any other questions? Perhaps, can you check the chat? Is there anything?
Question, are these programs mandatory for all students to take, or is it up to the student to decide on it?
Yeah. So I did not include in the slides the mandatory programs that students do take. So for those
Good
of you who have
question.
new students, they've all completed 3 required self-guided learning courses, one focusing on diversity, inclusion, belonging, one focusing on sexual assault prevention, one focusing on alcohol and other drug prevention. They also, through their orientation program, saw me and my colleague Liz Humphreys, who's our Director of Student Conduct, who also went over a little bit more specific kind of community well-being. And Peter had also done a session. So there's some programs that our students have all taken part in. The ones that I had referenced up here, the bringing in the bystander program. Right now, we are focusing more on student employees on campus and certain student groups. So we will be running about 2 to 3 trainings per month. Those will, for certain student groups, become mandatory once those groups request it. It's not our first time running bystander education. And what usually happens is once we start presenting to various entities, they say, I want this for my club. And so then it becomes mandatory for them. But the rest of the programs are more student self-identified, and they will sign up to participate in them.
Although I know some of your larger programs, either athletes are highly encouraged to participate, as well as those that participate in Pan-Hellenic activities are always very strongly encouraged to attend. your
Yeah,
programs.
I say strongly encouraged, but actually what happens, especially with our students who are involved in fraternity and sorority life, is that their leadership and their students who look specifically at risk management actually like to partner with us, especially our team, because we help them, I would say, look at things that like problem solving within their groups and organizations, and thinking about like, how do you go as far upstream as possible so that you are looking at supporting well-being, you know, within your student body that you're working directly with, and not necessarily, I would say, like responding to, you know, responding to an issue, rather like, let's go far back enough so that you all are building that safer infrastructure within your groups.
Great. Any last question? Yeah, go ahead.
The forms that they suggest that before your child is when they turn 18, like the HIPAA, where would we send those?
Questions about forms, about the
If they get in,
parental consent forms, essentially.
if they get injured or whatever.
Yeah, so students would have already been asked to update their emergency contact information in kind of workday. And so please know that if there is ever an emergency involving your student and your student is being transported medically to another facility, somebody, a member of University Police, a member of the health center team, or a member of residential life, whoever is kind of the responding party at that point in time, would take the lead in contacting you. But when it comes to you corresponding with, say, a nurse practitioner who is providing medical care for your student, that student would need to sign a release at that point of care for you to have that conversation. And our staff are incredibly good about saying to a student, like, you know, is there somebody that we can call to tell them what's going on? Especially if it's, you know, if it's something like they jammed their finger, that's different. But if there's something more concerning that's happening, that might require a referral to a specialist, for example, our team is always going to be working with the student. Usually the students are like, yeah, can we please call my parents? The medical provider would actually sit with the student in the room and have that conversation. So they do their best to bring you into the fold, but it would be, there's no blanket consent form for the staff that's a release to speak with you. It would be still by that individual case-by-case basis.
Thank you. Now, if people want to follow up with you after today's session, what is the best way to get in touch with the two of you, and perhaps for Julia as well? I know the health center email gets responses very quickly.
Yeah, I think actually if you scroll through the slides, I might have put, oh, nope, I must have taken it off. I apologize. What we can do is, you have a list of registrants. So maybe what we can do is email out to all the registrants. But I would say email is probably the best for getting in touch with me or my department. I do, for the folks who are in the audience, I do have my business card if you'd like to take it. I know you stress your phone number because you have Linda with coverage. So maybe phone is best for you as you're within, you're with
Probably,
with students
yeah.
during the day.
Certainly, and if I can't be reached, then one of our staff can, and they'll be able to answer questions. But if you find, you can also go to our website, which the counseling center, and then there's wellness and promotion, health promotion, and
Yeah, so
and prevention.
it's www.bentley.edu/health, or Peter's is bentley.edu/counseling, and mine is bentley.edu/wellness. So we all have short names that are associated with our office titles.
And you can access our staff list, which has email address, I think. Yeah.
Excellent. And Bethany is typing it in the chat, I believe, for those of you on Zoom. So thank you so much. Is there anything else that you want to share with us this afternoon?
I would just say, don't hesitate to reach out. If there's ever a concern, go with your gut. For those of you, you know your students best, and you know when something is not right.
Mhm.
And don't hesitate, even if we're seeing your student, we can't speak specifically.
Yeah.
We can provide guidance and talk through resources. And then I would say the last thing is we have a behavioral intervention team on campus called the CARE team. I know Peter and some of his staff liaise with that group, but there is a way for you to submit a report. And we have a case manager who goes through those reports. And so this would be for non-emergent situations, but you can share anecdotal information or concerns about students' struggles through a CARE report. And then the team would identify a staff member to reach out to that student and get a sense of what's happening, have actual physical, eyes on that student, have a conversation, and get them connected to the support that they need in that moment.
Mhm.
Any last thoughts, Peter?
Well, I'm glad to be talking to you all, but the one thing that kept popping into my head, I recently had a conversation with a parent that I think was really helpful, is also coming out of COVID, given what I had said before, students are really sort of rediscovering their social lives. And so in terms of having those conversations about priorities and expectations, I think there's going to be a natural gravitation towards, I want to, hang out with my friends. I want to be a social being, and that sometimes can interfere with their other priorities. So just if that's a part of the conversation you're having with them, I think that's the best way to address it, but making sure that they're getting those absolutely essential experiences of connecting with others.
Excellent. Well, thank you both for your time today. We really appreciate it. And thank you all for joining us. We hope you enjoy the rest of your Falcon weekend.